Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. I'm going to use a standardized kind of breast talk that I use. Please remember that breast cancer is literally thousands of different diseases. The biggest problem that we have is that there's so much fear around breast cancer that a lot of misinformation's out there. And as soon as you tell someone, oh, I have breast cancer, they tell you all their horror stories and all of the trauma that they're coming from. It is true when you get diagnosed with breast cancer, it is a trauma. So I always recommend seeking the help of a spiritual advisor, coach, or therapist for every single person. There's also a grief reaction: mad, sad, bargaining, denial, acceptance. So it's very important to get support to help with the mental and emotional aspects. The mental and emotional aspects of breast cancer are the hardest parts. And everything is mental, emotional, physical, and spiritual, like the legs of a chair or legs of a table. And if one area is off, and I know this may seem surprising to you if you just received a new diagnosis, but the physical aspects are actually easier than the mental and emotional when you're diagnosed with breast cancer. 30% of people diagnosed with breast cancer in the 1980s died of the disease. Now it's less than 3%. We have better treatments. We do less surgery. We do less radiation. We have a greater variety of medicines, all with less toxicity, and survival is astronomically better. In general, the majority of people nowadays do not die of breast cancer. The majority of people live. People with inflammatory breast cancer have a greater challenge, but still there's much more excellent survival now than there was even 5 or 6 years ago. The same thing with metastatic or stage 4 breast cancer. We've all seen the ads on television. People with metastatic or stage 4 breast cancer can live decades. One of my dear friends lived over 25 years with metastatic cancer. And with new innovations, that may even increase. So please know, no matter what stage of breast cancer you can have excellent survival. Now, for everyone, I always recommend, once you're over the age of 18, make sure you have a will, a healthcare proxy, and a power of attorney. That's for everybody, whether or not you're diagnosed with cancer. But when you get diagnosed with cancer, what we need to remember is the breast is mostly made up of fat. There's lobules and there's ducts. The ducts bring the milk out and the lobules produce the milk. In the breast, the only other anatomy are some blood vessels and some ligaments that hold things up, called Cooper's ligament. The majority of people who get breast cancer in their ducts, called ductal carcinoma. In the duct, there can have duct cancer that stays inside the duct, called ductal carcinoma in situ. Ductal means of or relating to the duct, and in situ basically means that the cancer is staying inside the duct. We know that there are multiple variants of DCIS, and we're trying to learn more about them. But some versions of DCIS will continue to grow outside the duct, and that's called invasive ductal cancer. The lobule can also have cancer cells. That's called invasive lobular cancer. In a different video, I'll talk about the differences between LCIS and DCIS. But for here, I just want you to know that DCIS is a stage 0 breast cancer, where LCIS is not breast cancer. It's only an indicator that you're at higher risk of expressing breast cancer in the future. And interestingly, that's of ductal type usually. So 80% of people who get cancer get it in the ducts of their breast and about 20% in their lobules. There are other rare cancers which I'm not going to talk about in this video. So when you're diagnosed with breast cancer, you want to learn, is it a ductal type or a lobular type? And is it in situ or invasive, that is growing outside the duct or lobule into the fatty tissue? Then we stage breast cancer based on the size of the tumor. If it's less than or equal to 2 centimeters, that's what we call a T1. 2 to 5 centimeters is a T2. And greater than 5 centimeters is a T3. T4 means it's growing into the skin. So by definition, inflammatory breast cancer, which we'll talk about in a different video, also is a T4. T will contribute to the stage, but is not the stage. The stage is made up of multiple factors, the core of that being the T, or tumor size, the N, which is node. Did it spread to any lymph nodes? Most commonly the lymph nodes in the armpit or axilla. And then M is the metastases. Breast cancer tends to go to 4 places: the brain, the bone, the liver, and the lung. Again, the majority of people are the stage 0 or in situ patients, DCIS, or the T1, less than or equal to 2 centimeters. But I have good news for you. Whether you're stage 1 or stage 2, which is really based on the T1, T2 somewhat loosely, you probably have 100% survival. The most important thing to remember when you're diagnosed with breast cancer is most likely you're going to be told that you have a 100% chance of surviving. When you hear the word cancer, you think you're going to die. The majority of time with breast cancer, you're not going to die. Also, we use less and less mastectomy, or full removal of the breast, to treat people. We've learned that breast conservation, or what's now called a partial mastectomy, which used to be called a lumpectomy. Lumpectomy means removal of a lump, but because we're catching so many cancers earlier with mammogram, people have a partial, some of the breast tissue, partial mast is breast, ectomy is removal. So most people are treated with a partial mastectomy, and then a separate surgery is done to check the lymph nodes to see if the cancer has spread. It usually takes about 1 to 2 weeks to get that pathology answer. So most likely you have 100% survival, but you'll check with your clinician when you get your diagnosis. And then most people will get the partial mastectomy. People who have cancer in multiple areas or for some other reasons still may need a full mastectomy. Also, sometimes people choose a full mastectomy because they are genetically positive. For a number of reasons, many patients, if not most, will be offered genetic counseling and testing at the time of your diagnosis. What's interesting is only patients who carry the BRCA gene, the one that was made famous by Angelina Jolie, the BRCA1 and 2 genes, those patients may benefit via survival and recurrence rates, which are the 2 things we look at with people with cancer, from a full mastectomy. But other than that, it is rare, or much more rare nowadays, that you will benefit from a full mastectomy. There's also some data to show that a full mastectomy done unnecessarily may increase mortality rates 10 years out. We don't understand that, and we're still looking at that. So the majority of patients diagnosed with breast cancer will have a partial mastectomy, the tumor removed with a slight rim of normal tissue around it, as well as the lymph nodes checked. We have 3 ways of treating all cancers: surgery, which is the mainstay for breast cancer, radiation, and medicines. Now, I told you that we do less radiation than we used to, and certainly just like the diagnosis of breast cancer, radiation instills fear in people. I can tell you that the only side effects really of radiation therapy after breast surgery is tiredness. So you're more tired after surgery for at least 2 months. And then you have the radiation on top of it, which will make you more tired. Many people will invoke the FMLA in between temporarily to help them get through these different stages. I know you want it to be over and you want certainty. Well, there is no certainty, and that's the unfortunate piece. But we can be more certain that you're going to survive well from your breast cancer. The radiation is used less and less in women over 70. So again, this is an individualized treatment, as are all treatments in breast cancer. So many patients will start with their surgery, and then about a month later will have radiation, which will last about 3 to 6 weeks. And then people will take a pill. If you carry an estrogen positive tumor, you would benefit from taking a pill to prevent your breast cancer after surgery or radiation if you have them. And those you take anywhere between 5 and 10 years, more very commonly 7 years. we have a much greater variety of medicine. So you'll see the medical oncologist for the medical aspects, the radiation oncologist for the radiation aspects, and the surgical oncologist for the surgical aspects. Although the surgeon, like me, will often help make sure with the navigator, usually there's often a nurse that helps you navigate or travel through all of this, will help you through that. And certainly the surgeon will usually describe to you all the different aspects that may or may not affect you. At many facilities, such as ours, there's a tumor board where you get multitude of second opinions where we present your actual films, your actual pathology slides, and you get at least whoever's there, 20 to 30 different opinions about what's happening to give you an individualized treatment plan. Again, here I'm only talking generally. So surgery, usually just take out the cancer with a normal rim around it. Surgeons like me perform oncoplastic surgery, so we try and hide the scars and then put the breast back together so it looks beautiful. We want to take into account that we don't always want to be reminded that we're cancer survivors. You want to have a beautiful cosmetic effect. You want to feel beautiful in your body, have a great self-esteem, and also not have it bother you with any kind of sexual intimacy. So we take that into account as dedicated breast surgeons. So the surgery, and then usually about a month later, the radiation. Now, 20% of patients will need chemotherapy. And this is not like it was in the movie Beaches, but you do lose your hair, which is usually very traumatic for many patients, and we can help you with that. There are some places that use an ice cap, but my personal is not, most patients don't strongly benefit from that. There are 20% of people who need the IV chemotherapy. Some need that chemotherapy before surgery, and some need it after surgery. If it's given after surgery, it starts about a month after the surgery, and then the radiation is given after that IV medicine. And then after the radiation, the by-mouth medicine is given. So to summarize, 3 ways to treat breast cancer: surgery, medicine, and radiation. 20% of people will need the IV kind of chemotherapy. Some of that we decide up front, and some of that we decide after. How do we know if you get it before or after surgery? If you're HER2 positive, you get usually the chemotherapy before surgery, but not all the time. If you're HER2 negative, we won't know for sure if you need chemotherapy until we take out your tumor. There are a number of reasons why some people won't need this test, but while we do a genetic test of your body at the time of diagnosis, after surgery, we do a genetic test of your tumor. That's called an oncotype test. That test helps us determine whether or not you will benefit from chemotherapy. That test also takes about a month to come back. If it comes back positive, you go on to chemotherapy, and then after that, the radiation, and then the pill if you need it. If it comes back low probability, then you just go to radiation if you're having it, and then the pill if you're having that. So those are the main broad ways that we treat all cancers: surgery, radiation, or medicine. And to summarize completely, surgery is usually a partial mastectomy or some removal of the breast tissue, not a full mastectomy, but some people do get the full mastectomy, and then we check lymph nodes in anything that's stage T1 or higher. We do not check lymph nodes for in situ disease. Then after surgery, we see whether or not you need chemotherapy. If not, you may go to radiation. If you do, you start with the chemo, and then radiation, and then the anti-estrogen pill. Biggest things to remember are that your fear is worse than anything, and the antidote to fear is telling the truth with as much kindness as possible. If you don't understand, ask, and it's always good to bring someone with you to your medical appointments. And if they can't, then have someone by phone and ask the clinician if you can have someone on the phone with you to help you take notes. Also, you can ask your clinician or navigator or someone in the room to help take notes so you can write it down. The first appointment, you're barely going to remember anything, which is why I wrote a book to help people remember at least these broad strokes. And that's why I made this video for you. If you have any questions, please post them. Thank you.